NewsRme. World leaders commit billions to combat AIDS, tuberculosis, and malaria. After decades of progress against the illnesses were disrupted by the COVID-19 epidemic, the Global Fund to Fight AIDS, Tuberculosis and Malaria obtained $14.25 billion in vital additional financing. President Joe Biden of the United States, who hosted the conference in New York City alongside the annual high-level meeting of the United Nations General Assembly, UNGA, stated that the funding, the most significant amount ever pledged to a multilateral health organization, is essential to combating the diseases. In the following 4 years, this expenditure will save an additional 20 million lives and cut mortality from these illnesses by 64%, as stated by Biden. The fund, a public-private collaboration established in 2002, is seeking $18 billion from governments, civic society, and the corporate sector for its next 3-year financing cycle. Before Wednesday's conference, more than a third of the sum had already been raised. Peter Sands, executive director of the Global Fund, described the mobilization of resources for global health as unprecedented. Biden exhorted, "Thank you all for stepping up, particularly in a hard global economic context, and I encourage you to keep it up." The Global Fund said that the $14.25 billion sum would likely climb when additional contributions are received. The United Kingdom and Italy have said their pledges will be made public later. Lazarus Chakwera, president of Malawi, said earlier in the day after donating $1 million, "For the government and people of Malawi, this is not a conference but a lifesaver." According to UNAIDS, in 2021, there were 990,000 adults and children living with HIV in Malawi, and according to USAID, TB is a serious public health issue in Malawi. The United States has pledged the most among contributors at $6 billion.